Hello and welcome to the U.S. Conference of Mayors and Verizon Roundtable Series. I'm Andy Serwer, Editor-in-Chief of Yahoo Finance, a division of Verizon Media. Our weekly roundtable series called A National Discussion on Achieving American Breakthroughs continues. We'll speak with key mayors and CEOs engaged in a dialogue on some of the biggest challenges facing American cities today. The topic today is COVID-19 and health equity. And with that, let me bring in Hans Vestberg, Chairman and CEO of Verizon, for opening remarks. Hans.
Hi, Andy, and great to be back on this series and this webinar we have together with the U.S. Conference of Mayors. And I would like to start by thanking all the mayors tuning in and having these engaged discussions. And of course, thanking my co-host as well, the CEO, Tom Cochran. Let me start by just reiterating what we have done the last couple of weeks in this series of achieving an American breakthrough. The first week we talked about the economical recovery, and last week we talked about dismantling racism. So we're really trying to have a public-private conversation about some of the toughest things we have facing us as private companies, but also as in the public sector. Today, as Andy said, we're going to talk about the COVID-19 and the health equity, which is another topic. I mean, we have a health crisis, which is the worst in mankind, impacting people and organizations as we have never seen before. And I think for me, as a leader of a corporation, this is something totally new. I've been into crisis, I've been into telecom crisis, banking crisis, and diminishing sales volumes, but I've never been in a crisis where my employees and my customers are so heavily impacted. So the playbook is obviously not given, how you work in an environment of COVID-19 with this health issue you have. We decided very early on in Verizon that our mission was clearly the safety and health of our employees. That was the number one. Together with seeing that our customer can be connected. Given our mission as a company with mobility broadband services, we understood how important that was for our customers in the time when they couldn't be face-to-face with their colleagues, family, and friends. The connectivity became sort of the lifeline. And a couple of things that was important for us in these times. On the employee side, we decided for extended caregiving time for everyone, any employee that would be impacted. We had up to 8 weeks of full payment, and actually you can actually take a couple of months with almost full payment. That we understood that this would be so important for our employees. We didn't want them to be distracted. We also refurbished all the way our stores are set up, and we will hear later on from some of the prominent guests we have on this panel also about how they have done it, because it's a totally new environment for our stores and our store employees. We also did a lot of other things for our employees, which are very important when it comes to thinking about them as a first responder out there together with our customers. This has been, I think, very difficult for many of our employees. We decided to have a daily webcast with all our employees we still have it, but for 9 weeks, I attended a daily stand-up with all our employees, 30 minutes every day to communicate what is happening because of the uncertainties and insecurity that happens in an organization. We have 140,000 employees across the globe, but mainly here in the US. So that became very important for us to cope with this COVID-19. And it's not over. We all know that. This is a disease that will continue and will probably not go away for quite a long time. And finally, we work with a lot of return to office. If I then talk about our customers, of course, the first thing we decided was to increase our CAPEX. We didn't know how the network would be used. So we decided to increase our investment to up to $18.5 billion this year in capital investment in the United States. We did it because it was the right thing for the country, and it was the right time for our customers. So we did that very early on in this pandemic. Our network has held up very well. And we also decided to keep America connected, which meant that we have not disconnected any consumers, wireless or on fiber that couldn't pay. we put them in a system that we can work with them over time. We know that they're going to continue to be our customers when they come back and have a much more better economical situation. So things like that has been important for us. And why it's been important, many of the decisions you take in a crisis like this will be the perception of your company or your organization for years to come. And you do the right long-term decisions for your stakeholders in times like this. And I think all your stakeholders will be whole over time, meaning employees, your customers, your shareholders, and the society at large. So that has been the guiding principle for us. But again, I'm here to learn and listen how we can even do it better. And on the panel today, we have Mayor Libby Scott from Oakland. I hope she will have joined now, or she will join in momentarily. Mayor Latoya Cantrell from New Orleans. And we have also from the private sector, Larry Merlo, the president and CEO of CVS Health, and Kevin Marchetti, co-executive chairman and co-founder of Lineage. So we have a great team here to discuss how to tackle the COVID-19 and the health equity in the country, and what we can do as private companies and as cities together. So I would like to hand it over to the CEO of the USCM, Tom Cochran, for a couple of words.
Thank you, Hans, and just want to thank all the mayors and the CEOs for joining us today. We greatly appreciate this exciting partnership with Verizon, breathing life into the American Breakthrough, the vision of our president, Greg Fisher, with the 5 working groups that many of the mayors on the call today. COVID-19 has issued a double whammy on many Americans economically and health-wise. It has sickened 7.6 million Americans in our cities, large and small. And the deaths, as you know, are 200,000 and upward. This morning, more bad news. 36 states are surging, and no states are in decline. The governor of New York declared today that we're halftime. We're in the locker room. We still got a long way to go. Now, what we know is this pandemic shows is what mayors, already knew, that certain groups are suffering more than others. People of color, workers with low incomes, people who's lost their jobs, and many people that were struggling financially even before the economic downturn. And that's why today's sessions focus on how leaders are responding to improve the equity. Equity is a big word. Equity of healthcare now and in the new normal. The United States Conference of Mayors has a long record on healthcare. Starting in 1972, bringing it through the Obama administration with ACA, fighting when they tried to destroy it, and even now with the discussions that's going on with our high court, we are concerned as to whether or not we can continue with the health care in this United States. At the United States Conference of Mayors, health equity has been and will remain a key priority. Thank you so much for Verizon, Hans, and all of your team for helping us talk about this today. And now I'll turn it back over to you, Hans. Thank you so much.
Yeah, thank you. And Andy, I give the word to you to manage this distinguished panel.
Thank you, Hans, and thank you, Tom. Before we begin, I want to encourage all the mayors that have joined the webinar to submit questions, and you can do that on the right-hand side of your screen. Please send your questions in now, and we will get to them. On the bottom left-hand side of the Blue Jeans platform, you have viewing options, by the way, grid view, etc. So you can play around with that. And also just want to let you all know that today's event is being live streamed on Verizon and the USCM's LinkedIn pages, so please go ahead and share. We do have a great panel here, private sector and the mayors as well. And I want to start off with Mayor Schaaf and ask you about your city, Oakland, California. And maybe just one thing that we've really discovered, and Tom touched on this a little bit, is how every locality is so different. And so I think that people might be interested, Mayor Schaaf, in the state of play in Oakland right now, where things stand and how you're looking to address things at this point.
Oh, well, thank you. It's such a pleasure to be here. Libby Schaff from the great city of Oakland, California. Thank you. I do want to give a special shout out to Verizon, our host today. Your team here, JJ in particular, have been a really big part in our recovery. Say that COVID is not just about responding in the moment. It is about figuring out how we can build back better. And one opportunity that we've really taken advantage of is closing the digital divide for good. And that has significant health implications. As we look to a future with more telemedicine, with more life-saving information delivered through the internet, and with that connection to the rest of the world, more important than ever for places like Oakland that are still under a pretty significant shelter-in-place order. Digital access and digital literacy is more important than ever. I am pleased to say that just yesterday, we were officially moved to what we are in California calling the orange tier. And that means that we have had significant reductions in our positive tests. And California has also introduced an equity measure. And that means you cannot get awarded a higher tier unless you can demonstrate that the difference between your most impacted zip code and your least is not so far apart. And I want to applaud California health officials for having that equity measure. In Oakland, we have really focused on our cultural competent community-based partners. We've really empowered our community health centers. And we've communicated what they've learned up to the state. And it's actually affected the way that testing has been delivered, allowing people to do free tests without having to register through an online platform, allowing walk-up test sites, not just drive-up. So these are some of the things we're learning. We are cautiously optimistic that we are seeing a flattening of that curve. We anxiously await the creation of a vaccine and are standing ready to ensure that the distribution of that vaccine is equitable and starts to address the tremendous health disparities that COVID-19 has only exacerbated and shined a bright light on. Thanks for having me here today.
Thank you, Mayor Schaaf. I had no idea about that equity measure. So it's really fascinating and terrific to hear about that. And that's actually, speaks to that point that I was making about regionalism and how important that is when we're understanding what's going on in this country. I want to go over to the private sector, and boy, what Kevin and Hans and Larry have to deal with is equally vexing. And that, someone like Larry especially has this, Hans too, of course, has this national footprint that is incredibly daunting. Stores all over the country, thousands of employees. And then, of course, you've got to get the people in the stores. Then I think you're going to start to talk about distribution of the vaccine when that comes, or certainly therapies. Larry, I'm just going to give you an open-ended question, which is how are you coping with all this? And what have been your priorities?
Well, Andy, let me thank you and Hans for hosting and the opportunity to be with you today. And let me thank the mayors for their leadership in communities across the country. Andy, I think I'll probably start and pick up where Hans left off and maybe underscore some of his points, because as a large company, we've got recovery plans for many things: hurricanes, floods, fires, tornadoes, and the common denominator across those plans is they're geographically concentrated, they're time-based. And as Hans pointed out, nowhere have we experienced something that it's not just coast to coast, it's across the globe. And even as we sit here today, 7 months into this, there's still tremendous uncertainty as to how the finish line is defined. And I go back to March, and one of the things that oftentimes we do is we've got a great organization, a great culture, and oftentimes we take a pause and really try to understand what is it that we need to solve for, and what emanates from that are a set of guiding principles that, in a period of tremendous uncertainty, we'll use as our roadmap as we have to go about making decisions. And much like Hans talked about, those guiding principles included the health and safety of our colleagues and our customers, and the importance of communication and in a period of uncertainty where even myself, it was one of the few times where we were hosting calls twice a week and all hands on deck, and knowing fully well that I didn't have all the answers that I normally would have to the questions that I knew that were on our colleagues and customers' minds. And but very quickly, we responded to what were the needs of our colleagues, and and putting special programs, recognizing that their commitment to our company and their customers was also being challenged by their commitment to their family and their personal lives, and how do we help them navigate that journey. And we did a number of things to ensure not just their safety but their financial health and well-being, and not putting them in a position where they had to make choices that create I'll say not win-win relationships. And and as it related, Andy, to our customers, one of the things that we quickly were called upon, and I'll put it under the heading of public-private partnerships. We're in about 10,000 communities across the country, and today about 75% of the U.S. population lives within 3 miles of one of those CVS pharmacies. And how can we be part of the solution? Whether it's ensuring that our customers continue to not have their prescription therapies interrupted, or the role that we could play in addressing the COVID pandemic, and very quickly that emerged into playing an important role in testing. We started in 5 states with large-scale drive-through testing sites, and as we sit here today, we now have more than 4,000 sites across the country. We're utilizing CVS pharmacies, but we've also built kiosks. We put those kiosks in historically underserved communities, and where we've seen positivity rates more than 2 times the state averages, if you will. And then we've done a number of other things. Mayor Schaaf mentioned digital and virtual care, telemedicine. We were able to expand telemedicine services to make it easier for physicians and patients to connect. We waived consumers' out-of-pocket costs associated with virtual care, as well as any out-of-pocket costs for testing or patient treatment, and we'll continue to do that. It's interesting. A group of us were having a discussion. This is fairly recent. Someone asked me the question that, well, Larry, when does this end? And look, we're keeping our fingers crossed. That I know our scientists will find the vaccine, and we'll see more treatments. But until that point in time, the best treatment right now is good social hygiene. And we got into this discussion, and someone said to me, Larry, do you know how many years it took to get people, to get into the habit of wearing a seatbelt? And we're talking about the role of facial coverings, the mask, and we're trying to accelerate what took years into a matter of weeks in terms of practicing good social hygiene practices. And that dynamic's very real, and it's one of those dynamics associated with help me help you. And but again, I couldn't be prouder of the work of our CVS Health colleagues in communities across the country.
Great. Lots of work there, Larry. That's right. And testing and personnel and just a ton of stuff. And then, as I said, down the road, maybe dispensing a vaccine, but who knows? Too early to really make a call there. I want to go over to Mayor Barnett. And I don't know if the organizers did this on purpose. We have the mayor of Oakland, and then your city is in Oakland County. Coincidence or not, Mayor Barnett, what do you think?
Well, I'm looking over Libby's shoulder. I think we use the same tree in most of our promotional stuff in county as well. So,
Right. Let me ask you, Mayor Barnett. I mean, your city's not as big as obviously Oakland or New Orleans, and 75,000, I think, population roughly. But the problems can be just as acute, and also specifically when it comes to equity. So, also, what's going on in your city right now, and how is the rate, and how is it? How are you trying to impact and stem the tide there?
well, first of all, thank you for the invitation, and of course, I do want to thank our host today, Hans, and your team. We are Verizon customers here in the city of Rochester Hills, so we appreciate your leadership. And to my friends, Latoya and Libby, it's always good to be with you. You have some wonderful mayors on the panel. I have watched the last few, and they've been both informative and applicable, and I hope today's is as well. I think, listen, my city's 75,000. I don't apologize for that. There's a lot more communities across the country that look like ours, and suburban communities that are dealing with these things. And I think we've all sort of learned, no one ran, Libby, Latoya, or myself ran on, we're the best to handle a pandemic. And so you sort of learn on the fly. And as it relates to, our communities in Southeast Michigan, we were hit early. Michigan was one of the first states, along with New York and New Jersey. We led the curve, and we were in a really bad way here. But we've since come down at the moment. We sort of sit, I think the description of it being sort of halftime is probably appropriate. One of the things I did, the very first things I did, which probably it sounds like all of the CEOs who've discussed this, they gather their team together and they expand their team. Who needs to be on the team? What are the leaders you need at the table? For me, because I don't have a health department in my city, I needed the CEOs of the hospital systems that are in my community to be at my table, at my Zoom table, every week talking to me about what they're seeing and how we can help. Because, typically it's a Rochester Hills first responder taking them to a Rochester Hills hospital. And then what are we seeing once they get there? How can we kind of work together? I mean, I never had the hospital CEOs engaged in much, relative to the city outside of the very things you might think they'd be a part of. But they were absolutely at the table. So were our schools. So were our nonprofit communities. So deciding who you had to be, who you wanted to have at that table was really important. We pivoted to basically become a different type of service organization. You talk about how we responded. We were no longer filling potholes the way that we thought we'd be filling potholes. We were turning our team members into making calls to our senior community. We looked and identified who's the most vulnerable among us, and it was a pretty sizable senior population. And so we were making 3,000 to 4,000 calls a week, wellness calls, just checking on our folks, picking up prescriptions at CVS and other places, taking them to our senior citizens. We delivered 15,000 masks. Every senior citizen in our community, we dropped off 5 masks for them just to get them through the week. I mean, we recognized what we were doing was not important. What we needed to do was to focus on those most vulnerable, to limit that, to try to deal with that equity component. For us, it was a senior population that was being told there's shelter in place, do not leave, do not go anywhere. And we then mobilized what we had, the resources of vehicles and manpower and team members to be able to try and meet some of those needs. And since those initial weeks of really dealing with that, we've been focused on some of the things that I think everyone's focused on. How do you get back? How do you start to build this economy? We've realized a few things that we didn't know before. Technology can be a great friend. During the time of building inspections, people wanting to get back open, we used to be in those buildings. Now we do everything virtually. Realize we don't have to go into a building to do an inspection. That's saved on both sides of the ledger, for us and for our customers in the community. So those kinds of things are important. We're learning new business models. I know in Oakland and New Orleans, they have a little bit longer seasonal weather, but for most of our restaurants that are still under 50% occupancy, I spent all day yesterday learning about igloos and how our restaurants, which, we turned sidewalks into fashionable cafes and parking lots into restaurant patios, because restaurants who build themselves and build models on 70% occupancy, only at 50% occupancy, had to figure out how to get more people into their restaurants. So outdoor seating is important. In Michigan, we lose the outdoor season. We could lose it tomorrow. You never know. These igloos, how do we make igloos safe for people to continue to have outdoor dining experiences? So things that weren't on our radar necessarily before are front and center, because we want to make sure that our most vulnerable are protected, that our business community is supported, that our residents understand that municipal governments, one of the great things we do as mayors, are connectors in our communities, communicators and connectors. And whether it's a message about, a cautionary message, an encouraging message, and whether it's just connecting the right people in the community, the private sector with those most vulnerable, or the resources that we have, that is my job as mayor of my city. And I know I'm pretty sure that LaToya and Libby feel the same way.
Thank you, Mayor Barnett. Before I go to big thumbs up from Mayor Schaaf, before I go over to Mayor Cantrell, I want to encourage all the attendees to please put in your questions. And I see there's a lot of you out there, so no hiding. And I'm sure you're curious. So Mayor Cantrell, welcome. I think, what's interesting is not all the things that Mayor Barnett's going to do in Rochester Hills are going to work in New Orleans, specifically igloos perhaps. But it's that call to action, I think, that's so important that he seems to embody, number one. And number two, understanding those inequities. And that's what this conversation is really all about, is COVID and equity. And I'm wondering, Mayor, what you're doing in New Orleans to address COVID and simultaneously the potential inequity that comes from COVID itself.
Well, first of all, thank you for having me, and of course, Verizon for hosting. And it's always good to be in the midst of my brother mayor, my sister mayor. We were on a call earlier this morning, Mayor Schaaf and I, with Bloomberg. So as it relates to the city of New Orleans, we were a hot spot in the U.S. from the start in March. And from being that hot spot, we were very much hit hard. We came into this pandemic at a deficit as it relates to the health and health disparities that are in the city of New Orleans. Out of the 588 residents that we've lost in our community, 437 of them are Black. And so that kind of gives you a sense of the disparity in terms of how it really did hit the Black and brown community in this city. And so we had to stand up very early on, robust testing, being very aggressive, but taking and setting up mobile testing in communities, taking it to the people, not for the folks to have to come to us, especially as we saw the alarming rates of community spread. And as a result of that, we have been able to beat back that surge by 96% flattening it, as well as I had to pull back. Once I started to open the city up a little bit, I had to immediately pull it back so that we would not go back into community surge. And so we were successful at that. So as of now, we continue demonstrating that we're slow and steady progress without any regression. Our rate of spread is, as right at 1%. We're very, very low. So all of those indicators that we measure, from hospitalization to how many cases per day, of course, that rate of spread that are not, we're down. But what the priority has been focusing on getting our kids back into school, meaning public school kids. So while we move forward with private and parochial schools at the state and those diocesan levels, we had to hold back our kids a little bit from going back into the classroom, but making that the priority. So as of today, we have a full complement of pre-K through 12th graders that have returned to the classroom. And again, as we monitor and watch and measure, we're still looking good. So with the lens of looking at public education, which is tied to equity, looking at our public school students that, again, pre-COVID were at a deficit when it came to academic achievement, although doing well, but still room for growth. But also understanding that every day my kids are at home, that it's impacting them not only academically, socially, economically, but trauma. And many of our kids were placed in traumatic environments in this COVID situation that we weren't even thinking about. So whether that was, hey, I got to go by daddy a little bit longer, whose girlfriend doesn't like me too well, but I have to deal with that. Or I got to go by grandma and I'm with grandma too long. Or, you know what, I'm at home with mama and I didn't realize mama had a drinking problem, but I'm seeing this all day long. So it's many different factors when we look at equity, that how we're trying to be laser focused on our people. And in the middle of all of this, I'm fighting back NFL and my Saints who are saying, let me in that Superdome that's enclosed, indoor, and they want me to be the first mayor in the United States of America to allow that. Absolutely not. Because I'm in a state that has spread all over, and now we're an island in this state. But at the same time, the pressures of what the priorities are continue to be put on us as mayors, but we have to stay focused. And I'm so proud to be with you all today and with mayors that hold me up, because that's the beauty of this type of convening. It's how we can share, but also hold one another up as we face the challenges and being bold about it and non-apologetic.
Here. Strong statement there, Mayor Cantrell. And I like the fact that, when football comes knocking and all those big dollars, that you're willing to do the right thing. And I know Mayor Schaaf has the same issues as well in her city with the little football team up over in there as well, right, Mayor? Oh, maybe on mute. We'll get back to you in a second because I want to go over.
My football team left me, so I have feelings about the NFL.
mine's talking it too.
But that's right. You go, Latoya. Stand up for that NFL. Sorry.
The Raiders now. That's right. Okay, I stand corrected.
Sore subject for this Oakland.
Sorry. My bad. All right, let's go over to Kevin Marchetti. And Kevin, you are the co-founder and co-executive chairman of Linear Logistics, and I'm curious how they play into the conversation here. I know you guys do logistics and supply chain, cold storage maybe. So talk to us a little bit about your company, what you're up to.
Yeah, Andy, thank you so much. And first and foremost, I want to thank all the mayors on everything you're doing. It's this time of crisis, it's critical, your leadership that you're showing, and we appreciate it all. We actually are active in all the communities here. Lineage is the largest in the world. And if you think about Verizon being part of the digital infrastructure and CVS being part of the pharmaceutical infrastructure, we are the food infrastructure. We touch over 100 billion pounds of food a year. So if you eat it, there's a good chance it's come through our facility, especially if it's temperature controlled. And we actually, we thought about the crisis. We launched our Share a Meal, 100 million meal campaign. We wanted to deliver 100 million meals around the U.S. primarily, but also around. And ironically, our first partnership was in the city of Oakland with Steph and Aisha Curry. And I think Mayor Cantrell mentioned this in talking about, food security is and having food is absolutely critical. If you don't have your food, none of this other stuff really matters. We were focused on making sure the food supply chain kept moving. And I think it's stabilized now, but I remember the days of March and April, there's a lot of concern about food and the availability of food. And so our employees were first responders, and they made sure they went to work. We didn't understand the virus. We didn't it. But, Steph and Aisha stepped up, recognizing that Oakland and Alameda, Oakland in particular, the students weren't in school anymore, and a lot of children get their lunch and their meals at school. And so making sure that these children had access to food was critical. And we actually took that program, we spread it at New Orleans. So we partnered with the Second Harvest Food Bank there. New York, we partnered with Kyrie Irving there. In Los Angeles, we really went around the country working with athletes and professional sports teams to help make sure that these communities had food and kept the food supply chain moving. So it's very, we're not really a well-known part of the world, but making sure the food kept moving was absolutely critical for us.
Great, thank you. I think you got a Blue Devil in there, didn't you?
Yeah, we did. We convinced, we got Coach K and we got a few other Blue Devils out there.
Right. Yeah, I know that about you. Hans, I want to go over to you and ask you about this issue, and specifically, obviously, COVID's been top of mind. You spoke about that and the employees and customers. But when you talk about the inequity that we're actually drilling down into, how does Verizon play there? I mean, you've got a big P&L to manage. So is this a challenge in that respect, and how are you looking at this?
No, it's not a challenge. I think that usually we have our four stakeholders that we manage, and we not compromise in between the shareholders, customers, employees, and society. But in a time of crisis that is totally unprecedented, actually you have to do priorities, and the priorities has been employees and customers as number one and number two, and then of course society. And I think that I'm not only thinking, I'm certain if I do right for those long term, it's going to be a positive impact for all my stakeholders. And that's why, for example, I mean, one example that we decided very early on, I mean, we closed our stores for a while, and then we had half time open. And we got a surplus of employees, a big one. And we decided we're not going to let anyone go. We're going to retrain them and give them a new opportunities after we're coming out of this. So we retrained 20,000 employees. And guess what? Today, I have multidisciplinary employees that can work in a store, they can be customer care, or they can be technical support. I would never have done that without this crisis. So you need to think differently how you do it, but clearly our focus has been to do right for the stakeholders, and that ultimately is going to pay off for my shareholders, because long term I'm going to get very committed employees. I'm going to have customers that are going to be loyal to us and stay with us for a long time, and that's and the investment we have done in our society and with the mayors on this call, that will pay off for our shareholders long term. So I don't think it's had been a hard decision making in this time, because this is something so different. There were no playbook, and I applaud all the mayors. There were no playbooks for them neither. Nobody has been facing something like this in their lives. I mean, we can say that we've been CEOs for a long time. I have never done anything like this, and that's why it's important also that you need to rewrite the playbooks when you're in a situation like this. And as we've heard some of the mayors saying, we're not out of this yet. I mean, this is something that Larry said, we don't even have a time on it, and we don't know, it's hitting all around the world. So you just need to keep the focus on your mission and the values in these types of times, and I think we have done it, but I see so many of my colleagues in the private sector as well. So I'm not saying that we are exceptional. I see so many of them, and we have been fortunate because we are in a business that is needed in this time. Of course, there are companies, airline industry or tourism, that has been extremely hard hit, in these times, which have no other option. But we had options, and we have taken that option and decided to do it right.
Thank you, Hans. I want to go back to Mayor Cantrell, and the other mayors can jump in after this and ask you about support from Washington, D.C. and from those quarters, and what your take is on that and the leadership there.
Well, this total freak show. And one that I'm not just experiencing from the federal level, but one that I'm experiencing at my state level. The federal government did allocate about $1.8 billion to the state of Louisiana, and was looking at population. We fell under the 500,000 population threshold that someone pulled out of the sky and said that would determine whether or not your city would get the funds directly or not. So we were one that did not get directly. The state received the funds. $800 million was supposed to be allocated for local and municipal governments, with Orleans Parish being the largest. We were up to receive about $150 million. The state legislature cut that $800 million to $500 million, and then have yet to reimburse municipalities for the expenditure. So, for example, the city of New Orleans, although we have submitted expenditures, they have been approved, an upward of over $200 million. Look, we've gotten $53 million. But even if it's just related to my population, I'm just saying, give us that. But I was at the legislature on yesterday, going to bat for the city to receive her fair share of these dollars, and was told pretty much we shouldn't have to bail you out. Now, it's not even their money anyway. But at any rate, that's an issue locally, but we're still in need, of course, a federal package that speaks to the revenue losses. Because as I talk about the CARES money, it was simply focused on expenses, not revenue loss. And being a destination city, an international city, I'm much like my Mayor Suarez in Miami, where we're both, and not just us, but we're not getting the dollars that we need. We need a package to come, but with the allocations coming directly to local governments like Orleans Parish.
Great. Before I go to the other mayors, I want to go back to Larry Merlo, though, and ask you sort of a similar question when I asked Hans. In other words, how are you deciding between a P&L and not, I guess? And I mean, when you do the testing out there, this can't be, necessarily a high margin business or margin business at all. And when the vaccine distribution comes around, potentially, as I said, that too, how do you balance these things out when you're looking at your business, Larry?
Well, Andy, look, it is a great question. And, much like we've heard from others, you go back to those guiding principles I alluded to earlier, and doing the right thing for our customers, our employees. I've never seen where that hasn't paid dividends. As you look beyond the task at hand, and we're playing the long game here. When you think about it that way, and Andy, you go back to we touched on the vaccine. We're talking about how the pandemic has hit Black and Brown communities especially hard. Look, we have recognized, we call it the social determinants of health for quite some time, and things like housing, education, employment. Maybe said another way, we've long recognized that how well and how long you live are shaped by where you live, and we have worked to reach into the communities with project health events. We've created partnerships, in communities. We're always humbly informed when we do these project health events and results in terms of how undiagnosed, chronic disease is manifesting itself in communities. And we're really doubling down as we think about this pandemic and the role that a vaccine will play. And we've created partnerships with organizations like the National Medical Association. It's the largest and oldest group of Black physicians in the country. We're also one of the founding partners of it's called the National Black Information Network, which is a new news service from iHeartRadio, and it's really geared to provide a trusted source of news coverage with a Black voice and a Black perspective. And Andy, I use those couple of examples because we're already starting to see the statistics. When you think about the importance and the role that a COVID vaccine will play, and the mindset that exists, across ethnicity, where we see our Black community very resistant, much more so than other ethnicities in terms of trusting that vaccine. And that's something that we're already thinking about, the role that we can play as a community resource, a trusted resource, and partnering with other trusted organizations that will make a difference in terms of ensuring that the vaccine isn't just accessible, but that it's being made available to to those individuals that have been proven to be more vulnerable to the effects of COVID-19.
Great, thank you, Larry. Mayor Schaaf, I want to ask you, I believe you've been in support, and I think Mayor Cantrell as well, of a program that would give cash to families in need to combat poverty and systemic racism. And I wonder if you could talk about that program a little bit.
Sure. Mayor Cantrell and I are part of Mayors for a Guaranteed Income. And Andy, did you really just ask a mayor what she thought of the federal government 20 days before Election Day? That was, I go with freak show. That was great.
I just asked the questions here. You guys provide the interesting answers, right?
But I'm going to put on my bipartisan zen right now, because that's really what mayors do. We like to say that, I think Jorge Alorza says there's 3 political parties, Democrats, Republicans, and mayors, because we are in our communities and we actually agree on quite a lot. And one thing I think that we've seen right now is that things like the PPP have had problems. And so when you give unconditional cash straight to people, it actually can do the most good. It is like the people's stimulus. We did a quick survey in Oakland. We found that 65% of our population had not been able to pay a basic bill or rent due to the effects of COVID. That is huge, and that impact is getting worse and worse every day. And I think there's a lot of agreement that another governmental program is not necessarily what is needed. The beauty of unconditional cash is it's really been demonstrated to go for these basic human needs. There is ample evidence to demonstrate that you can trust people to use it well, and people often use that extra cash to actually upskill themselves, to go look for a better job, to take better care of their family. Larry, I loved what you said about the social determinants of health. And this is really empowering families to get onto that road of self-sufficiency. I think the other thing that it really highlights is as the nature of work is changing, and as we're having things like COVID that create a just massive interruption to employment, the idea of a minimum guaranteed income really does make sense, because it is far better equipped to weather the types of economic disruptions like we're seeing right now than our traditional systems. So we're really excited. We are going to be piloting this in the new year in Oakland, focused on families, because we also know that there's a multiplier effect when you ensure that people who've got kids can go to bed at night knowing that they can keep that roof over their head and food on the table. It is something that in a country as great as ours, we should be able to provide. Very excited about it.
Mayor Barnett, I want to ask you about the mood in Rochester Hills. And we're talking about divides here, the rich and poor, healthy and sick, Michigan State. Big Ten football is going to be starting a week from Saturday, I know, and then you've got the election going on. How are people in your city feeling in terms of city pride and just feeling sort of a collective sense of belonging, if you will?
Well, it's a good question. I do want to go back to something, because I think the question you asked just a minute ago is critically important, specifically to the mayors that are watching. And by the way, I'm on a lot of things with LaToya, and I'll tell you that I usually, whenever Mayor Cantrell speaks, I put a little square jar over here, and I haven't put anything in it, so she's doing fantastic today. LaToya, you know, you're one of my favorites. Listen, you asked what the federal government response is, and Libby's response that mayors have to wear a bipartisan hat. I am, I think, the only Republican on this panel, and I've been pulling my hair out trying to figure out the direction of the administration, because we have been challenged trying to, the Conference of Mayors has done an excellent job. The last 3 months of my presidency, the current leadership under President Fisher, a beacon in the storm, talking about the need for federal funding to local municipalities under 500,000. In Michigan, only one city got money, and every other city didn't. And it's a huge, you talk about the inequity. The whole purpose of this thing is talking about inequity. That's massive inequity. The problem is not based on the population of your city. It is prevalent in every community. And so the need for us to have a strong federal leadership and federal direction on this is really important. And the other part of what we've been talking about a little bit as we move forward into to whether or not a vaccine comes forward and whether we move and how we move into that stage of this, you know, it's critically important that there is a strong national strategy. There wasn't with PPE, and New Orleans was bidding against Oakland, bidding against Rochester Hills for masks at the same time. Michigan was bidding against California, California against Louisiana. There was not a strong national strategy. And unless we have a strong national strategy when it comes to the vaccine, whatever there is risk, there needs to be some level of choice. And we have to have the ability to talk about how we're going to implement that in communities across the country. The mood in my city, listen, I've been mayor for 14 years. I'm blessed to have a community that's done pretty well. We've managed fairly well. We don't have some of the challenges that some of my colleague mayors have. But I'm telling you, people are uptight. They're tense. The mood politically is so many people are just turning off television, turning off Snapchat, turning off the radio, because it is a bombardment. We're in a swing state of political messages, and it doesn't matter where you are. Those messages are pretty much all you hear right now. And my job is to continue to do what mayors do. We have to continue to block and tackle. We have to continue to deal with the federal government that seems to be disconnected at times. Certainly we need them. We can't run away from them, but we need them to understand that the road to recovery, whether it's through COVID, whether it's the economy, runs smack dab through Oakland, through Rochester Hills, and through New Orleans. It runs through America's cities, and we are not going to stop telling that message to anyone who listens. If it's a continuation of President Trump, if it's a new administration, cities are where the action is at, and mayors are going to be leading that call every single day.
All right, well put. Kevin, I want to go to you for the last word, and then we'll go to Tom and Hans after that to close things up. Ask you a little bit about food and the supply chain and small, medium businesses. I mean, if you're supplying small restaurants, diners, and these companies and businesses have been hurt very badly, how do you see them faring going forward? Is there hope for them?
Great question. I think it is. Listen, they're extremely challenged right now. Seeing different cities important. I compliment a lot of the mayors. You have to deal with these issues locally, whether you're in San Francisco or Oakland, and I live in San Francisco, the Bay Area. I mean, everyone has their own different unique circumstances, or in the suburbs, on how they're trying to deal with these issues. From the food supply chain, these restaurants are in a tough situation, and it's been tough to see. We've seen a lot of our business more to retail, as obviously people are spending more time getting their food from grocery or home delivery. But the restaurants have been hit hard, and we always joke, in good times it's lobster, bad times hamburger. French fries we never thought would go down in consumption, but you never think about French fries being mainly consumed at restaurants. In any event, these restaurants are vital to communities. They are the small businesses. They are the lifeblood, and we've tried to do our best to help out. We actually partnered in Oakland, ironically enough, with Chef Jose, and his comment was, let's work with these local restaurants. Let's use them to provide food and the food infrastructure they have. We've helped with the transportation. Restaurants have been making the food, and we've been taking that to the communities. I think, I compliment all the mayors. There's not a playbook for this, and you just have to think outside the box.
Thank you, Kevin. Chef Jose, I've got to check that out.
Can I just say, this has been a miracle, and Kevin, we are so thankful. We're providing 25,000 meals a day for free to homebound seniors, to our homeless encampments, and it's keeping restaurant workers working. It's keeping these little cultural institutions alive, and it is ending food insecurity. It is a miracle, and thank you, Kevin, for everything that you've done. It's still going strong.
Yeah, no, it's excellent. Great
that it's all connected. Tom, over to you for some final thoughts before we go to Hans.
Can you hear me? Yeah, my final thought is, it is a freak show. You got governors doing one thing. We're trying to figure out the federal government, and God help us. And going back to Mayor Cantrell's point, we still are fighting to get stimulus relief of COVID-19. But here's what you need to understand, that with all of the stuff that's going on at the federal and the state levels, 50 states, what's the beautiful thing here is, when Mayor Schaaf said it, there is the bipartisan spirit of the United States Conference of Mayors. And so we are the last bastion of bipartisanship of this nation. And so I appreciate so much Verizon giving us an opportunity to show what we are. Because wherever we go, the United States Conference of Mayors in a bipartisan way is going to get there first. So thank you so much for having these incredible seminars, and we look forward to the ones ahead of us.
Thank you, Tom. Over to you, Hans.
Thank you, Andy. And as I did last week's, I don't try to summarize a fantastic conversation. I just want to say that I think we all are here to fighting for the safety, the health, and the prosperity for our citizens and our employees. And that common cause makes us do things that we have never done together. And it's so good to hear what Kevin is doing with the mayors and what Larry is doing with the mayors. And I think that Verizon is doing as well. But we are not unique in this case. And I think that we need to bring with us. There is no playbook for a COVID-19 for mayors, nor for CEOs of companies or enterprises. And we just need to come together because there's no time limits on this rare and brutal disease that we have in front of us that hits not only the economy but also hits more vulnerable parts of our society. So for me, this has been a really good conversation again, and with a lot of diversity. And I hope that the mayors and all others listening in, they got something new, which I got. And again, it's about listening, and it's about bringing more new ideas to your playbooks to do the right things in times of uncertainty and the COVID-19. So as Tom rightly said, I'm looking forward to next week's webinar where we're going to continue discussion on a new topic. And once again, I thank my co-hosts and I thank all the panelists for a great conversation. And of course, Andy, thank you very much for hosting us today.
Thanks, Hans.
Thank you, Hans. And we'll see everyone next week when the topic is we'll be discussing is eliminating poverty. Thank you all for joining us. See you soon.
Thank you. Thank you, mayors.
Thank you.